I'm Dr. Charles Klodell. I'm a thoracic and cardiovascular surgeon, which means that I'm board certified in both general surgery and thoracic and cardiovascular subspecialty care. I've been in practice now for over 20 years. I perform annually about 350 operations, ranging from diseases of the chest to any diseases of the heart or aorta. We take care of the full spectrum of thoracic and cardiovascular care, including aortic surgery, coronary artery disease, valvular heart surgery, lung cancer. All of those conditions are treated in our practice. One area that we do at an even higher level is structural heart disease, which is the treatment of the valves of the heart with catheters and wires and less invasive means. One of the benefits of being at HCA Florida, North Florida Hospital, is the multidisciplinary team that we have here, particularly as it relates to cardiac and thoracic disease. And when people talk about that, what you're talking about is having a comprehensive team. We have a group of cardiologists, cardiac surgeons, cardiac anesthesiologists, and then beyond there, the nurses, the occupational therapists, the cardiac physical therapists, and everybody who attends multidisciplinary rounds every day, participates in the care of those patients, and ensures that all of those patients meet the highest possible quality metrics. We were actually awarded a Center of Excellence designation for structural heart disease, and then we just recently recertified again as a Center of Excellence for structural heart disease or valvular heart disease. And that's currently very, very few centers in the United States that have achieved that designation. My approach in general is to do any procedure that any patient needs through the least invasive way possible, in the most comfortable way possible, and get them back to full activities as quickly as possible, all while doing that in an environment and with people that are all dedicated to a common purpose of making every patient not only live longer, but live better. It's about not only the quantity of life, but the quality of life that we can restore for them as quickly as possible.